I recently posted a very short video clip that was just a short moment from this podcast. And the video featured the renowned trauma expert and medical doctor, Dr. Gabor Mate. And in the video clip, he was explaining the 4 reasons why 80% of autoimmune diseases impact women. Now, this video exploded online. The only other topic I've ever seen resonate that immediately and globally was when I first shared the let them theory. Based on my inbox crashing, the DMs, and your comments, I'm like, we have got to go deep on the topic of autoimmune disease. And in particular, why is it impacting women at higher rates than men? What do you need to know? What are the symptoms that you may have that indicate that you have an autoimmune issue, but you don't even know about it? And most importantly, what can you do about it if you're concerned about your health or the health of someone you love? Well, today we're going to talk about all of that, and we're going to leave you feeling informed and empowered. I cannot wait to introduce you to Dr. Sara Sza. Now, Dr. Sza is a physician, a researcher, a renowned speaker on all things health. She graduated from Harvard Medical School as part of their joint medical program with MIT. She completed her residency at UCSF, one of the top hospitals in the world. Dr. Sza is the New York Times bestselling author of 9 books about health. She's also a clinical assistant professor in the Department of Integrative Medicine and Nutritional Sciences at Thomas Jefferson University and the director of precision medicine at the Marcus Institute of Integrative Health at Jefferson. Dr. Sza has over 25 years of clinical experience seeing patients, and she hopped on a plane. She flew across country for one reason. She did it for you. She's here to provide you with the information, resources, and the step-by-step treatment plan for anyone in your life who may be struggling with an autoimmune issue or just with some symptoms and they don't know what's going on. Today's conversation is a free, life-changing resource for anyone in your life who is struggling with an autoimmune disease or is just chronically tired or who has a lot of health symptoms and can't quite get to the bottom of what's going on. Well, today we're going to do our best to do that for you. And I want to thank you in advance for taking a moment right now to share this episode with someone you care about, because there's no doubt in my mind, everything that we are about to learn is going to improve your health and your life. Dr. Sza, thank you so much for being here. I am so looking forward to our conversation today.
Mel, I'm so happy to be with you.
Oh my gosh, we've got so much to talk about. And where I want to start is, could you tell the person who's listening what they might experience or how their life might change if they take everything to heart that you're about to share with us today?
A few things. First, energy. Right now, we know that 30% of Americans have antibodies against the nucleus of their cells, anti-nuclear antibodies. That is causing a civil war in the body, and it is keeping you from having the energy that you need to live your best life. Number 2 is regulation, that sense of safety that I think women especially desperately need right now. And then number 3 is empowerment. So having the tools and the insights that you need to make the changes and to make them stick.
That's a lot.
That's the promise of lifestyle medicine and a different approach to taking care of the body.
I've never heard the term lifestyle medicine. What does that mean?
It means that rather than deciding that you've got a diagnosis and giving you a pill, we want to think about, okay, how did you get to this place with this diagnosis? What are the lifestyle factors, your sleep, the way that you eat, move, think, and feel and love? How do we address those? How do we address those first? Because that provides about 80% of the prevention and reversal of chronic disease.
And that's what we're going to talk about, is chronic disease, and in particular, autoimmune diseases. So I want to start at the very just top, most basic level. What exactly is an autoimmune disease?
Autoimmune disease is when you've got a problem with your immune system. It becomes imbalanced. and it starts to attack your normal tissues. You can think of it like a case of mistaken identity. So your immune system is kind of like your private security.
Mm-hmm.
It's supposed to identify what's healthy and normal in your body, and then also find the invaders, like a pathogen, like a virus, and attack it. But if your immune system becomes confused and it can't separate those two, you can have this problem where your immune system is attacking normal tissue. So that's what happens with autoimmune disease. And in that situation, your immune system is making a weapon called an antibody. You're making autoantibodies, antibodies against your own normal tissues, and you can measure it. So with autoimmune disease, you've got this imbalanced immune system, you've got autoantibodies, and then you've got symptoms that fit with a particular diagnosis.
I love the word that you use, confused, that your body is just confused as to what is the enemy versus what it's supposed to be protecting. And as we kind of dig in deeper and deeper and deeper around what an autoimmune disease is, I have a couple just basic questions. Is there a difference between autoimmune disease and an autoimmune disorder? Because I've heard people refer to both.
The way I think of it, Mel, is that there's a continuum.
Okay.
So there's a state of health.
Mm-hmm.
Your immune system is working perfectly. It can separate the invaders from your normal tissue. And then at the other extreme is autoimmune disease. And that can be well established. And we'll talk about some of those conditions: type 1 diabetes, rheumatoid arthritis, Hashimoto's thyroiditis.
Wait a minute. Diabetes is an autoimmune disease?
Type 1 diabetes is. Yeah, you attack the pancreas. Your immune system attacks the pancreas.
I mean, I probably sound like an idiot that I didn't know that, but I'd never even thought that there are probably a long list of things that we talk about that people struggle with that a lot of us don't even know it's an autoimmune disease.
That's true. It tends to fly below the radar. And what troubles me so much about this is that these are the people who are often failed by the medical system. They struggle for 7 to 14 years before they get a diagnosis. So they could be somewhere along that spectrum from normal healthy to autoimmune disease. There's a pretty broad middle section where you've got antibodies that you can measure in the blood. When you've got early signs and symptoms, the fatigue, the joint pain, the other problems, and yet doctors often aren't putting it together until you cross that threshold into a disease.
Can you just list what some common ailments or diseases or things that people have that actually are autoimmune disease?
There's 2 different categories.
Okay.
So there's classic autoimmune disease.
Uh-huh.
There's more than 100 of them.
100?
100.
L-
And
What?
Yeah. So exponential rise in the number of autoimmune diseases, but it's things like rheumatoid arthritis, where your immune system is attacking your joints. There's Hashimoto's thyroiditis, where your immune system is attacking the thyroid gland in your neck. There's multiple sclerosis. There's type 1 diabetes, as we talked about, psoriasis. Psoriasis.
What? I'm sorry I'm reacting, but my husband and my daughter have really bad psoriasis, like all over their scalp. Like it's really gross. I mean, I don't mean to like throw them under the bus, but it bothers them. That's an autoimmune disease?
Yeah, your immune system is attacking your scalp in that situation. So a lot of people don't connect the dots. They don't realize that's not an autoimmune disease.
Why is it important to identify that something is an autoimmune disease? Like, let's just take the psoriasis thing that a ton of people struggle with. Why is knowing that that's an autoimmune disease help you in terms of being empowered about what to do about it?
It helps you address the root cause. And that's what's missing from most of mainstream medicine. What happens is you have psoriasis.
Mm-hmm.
You go to the doctor.
Mm-hmm.
You get a steroid cream.
Mm-hmm.
The steroid is like cortisol. It's like the stress hormone that you're sticking on your scalp. No one's thinking about your gut. No one's thinking about triggers that could be leading to your psoriasis acting up. So we want to do this root cause analysis. It's really critical. So there's 100 different autoimmune diseases. The list is long. Graves' disease, celiac, psoriasis, as we talked about. Then there's other conditions that have commonalities with autoimmune diseases, and that includes things like endometriosis.
Really?
When your body is attacking your own tissues, maybe you get endometriosis on your bowel or on your ovaries. It includes some forms of irritable bowel syndrome. You can even make autoantibodies with some forms. It includes chronic Lyme. It includes long COVID, post-COVID syndrome. So that's a more broad way of thinking about autoimmunity. But even if we just stick with the classic autoimmune disease, which every medical doctor would agree to.
What are the classic ones?
The classic ones, the most common ones are rheumatoid arthritis, type 1 diabetes, which we see in kids as well as adults, Graves' disease, Hashimoto's, celiac, which has been increasing phenomenally over the past few decades, multiple sclerosis.
So you used a word, I just want to make sure that I'm tracking with you because we're just at the surface and we're about to dive deeper. When you called it the autoantibody, is that the word that you used?
Yes.
So autoantibody is what you would find in somebody's body when the person's immune system is attacking itself. Is that right? That's the kind of medical evidence that, oh, the immune system is confused because I see that these autoantibodies are present, which are the little soldiers in the Civil War that you are feeling inside your body.
That's right. You nailed it.
Okay.
So the thing that I think is important about these autoantibodies is that they're in the body for years. And you don't know it unless someone bothers to check it. So if you look at one of the most common autoantibodies, anti-nuclear antibodies, what we know is that over the past 25 years, the number of people that have positive antibodies has almost tripled.
Tripled?
Over 25 years. Yes.
What does that tell you?
It tells me there's something in the environment that's changed. Our food system has changed. Our stress levels have changed. The level of trauma that we're experiencing has changed. And we'll get to the root causes, but the genetics haven't changed. It's the triggers, it's the lifestyle, it's the environment that has.
I posted this video and it featured Dr. Gabor Mate, a world-renowned expert in trauma, and he was talking about how 80% of autoimmune diseases happen to women. Holy cow, this topic exploded online. And you know what that tells me? That tells me that you want to learn more about the topic of autoimmune disease.